Thurman.
Here.
Bonta.
Here.
Chu. Grove. Jones.
Did you have other items that you wanted to present outside of the emergency preparedness aspect?
Well, there were the two BCPs. One was a special fund augmentation, and the other was the preparedness BCP.
Would you like to continue?
Well, unless you have questions, I gave you a summary of those, but...
Got it. Thank you. Thank you. Anything from Finance?
John Boccigalupi, Department of Finance. Just want to add to Dr. Backer's presentation that we're happy to work with them too in the identification of alternatives and thinking a little bit more about along the lines of your request.
Thank you. Anything from the LAO's office?
Sean Martin with the Legislative Analyst's Office. We're also, if we can help the committee in any way, looking over the information that's provided by the Emergency Medical Services Authority. Happy to do so.
Thank you. We got a team. We have a team effort in here. So, see, you're already inspiring teamwork in your approach. Thank you.
Excellent.
On this item, for these two budget change proposals, we have a recommendation of approving both budget change proposals as proposed by the governor. Can I get a motion to approve? There's a motion. Is a second? All in favor?
Aye.
Clerk will call the roll. We need roll. I'm ready to roll. I'm ready to roll, but the clerk will call the roll. Thank you.
Thurmond.
Here. Yes.
Bonta.
Aye.
Chu. Grove. Jones.
Motion passes. Thank you. The recommendation is approved. And we do look forward to our continued conversation. Thank you very much. And we welcome you to have other input as we hear from other colleagues from your department.
Thank you.
Thank you very much. Thank you. Moving on to issue 2. We have an opportunity to welcome a new department director for the Office of Health and Equity. We want to welcome Dr. Karen Smith. Is Dr. Karen Smith available? Welcome, Dr. Smith. We look forward to your presentation, along with Jamal Miller and representatives from Finance and the LAO's office. Dr. Smith, whenever you are ready.
Thank you. Good afternoon, Chairman and members. I'm Dr. Karen Smith, the State Health Officer and Director of the California Department of Public Health. I thought I'd just give you a few words about my background. I grew up outside of Sparks, Nevada, and where I was very lucky to attend, because my father was a teacher there, a very good high school which offered advanced science classes, including one in microbiology, and from that moment on I was hooked on science. I graduated from the University of Michigan, Ann Arbor with a bachelor's degree in microbiology, but before I could work up the courage to go into graduate school, I received a postcard in the mail inviting me to consider the Peace Corps, which promised to be the toughest job I would ever love. It was. I did. I was in the Peace Corps where I began my road to a career in public health. I worked in very small communities in Morocco and Thailand, and then subsequent to that also in Peru and Nepal. And it was during that work with those incredibly vulnerable and poor communities that I really began to have a passion for public health and to see what a difference it can make in the lives of people. I began my formal career in public health after my return to the U.S. by getting a master's in public health and international health. Initially, I went back to the idea of doing research and a PhD program in parasitology, followed by an MD and a clinical investigator fellowship. Infectious diseases, but then public health came calling again, and I began my career, which I continue today, working over 17 years in California's local governmental public health system, first as a TB controller and assistant deputy health officer in Santa Clara County, then as the health officer and director of public health in Napa, where I was until I was honored to be appointed by Governor Brown to serve as the California State Health Officer and director of CDPH. These are very exciting times in public health. In addition to emerging issues like Ebola and climate change, we're in the midst of a revolution in the field. We must continue our core missions of providing data and accurate, reliable information about the health of the population and of protecting the public through ensuring that food is safe, limiting toxins in our environment, stopping the spread of communicable diseases, and ensuring that healthcare institutions are providing safe care. But issues like the obesity epidemic and diabetes have demonstrated that we have to sharpen our focus on prevention. And in particular, we need to begin to address more thoroughly what we now know are the strongest predictors of lifetime health outcome. Those are things like where and how we live, play, learn, and work. Creating and sustaining healthy communities requires not only that we ensure that everyone has excellent and affordable health care, but also that we address these societal issues that affect long-term health outcomes. To do this, public health at all levels is creating new partnerships and embarking on novel, to us, pathways to improve health. As a director, I plan to build on the department's work on accreditation to look very carefully at how and how well we're serving the public, our stakeholders, and each other, and to continue expanding our technical expertise so that we can bring the best possible science to discussions about health. To be successful, we will need to become a more nimble organization, able to adapt to the rapidly changing environment in which we work. To be effective, we must maintain the highest level of credibility with our stakeholders and the public. Every community in California is unique and has unique assets and needs. At its core, the work of creating and maintaining healthy communities in California will be done in and by those communities. I believe that our role at CDPH is to facilitate that work in every way we can, including by bringing reliable information to the conversation and by convening broad and innovative partnerships like Let's Get Healthy California. I believe that we play a vital role in helping make every community in every corner of California better and healthier. And I look forward to working with the legislature to achieve this vision. Thank you, and I welcome any questions.
Thank you, Dr. Smith, and we look forward to working with you. Thank you for your vision. I open it to the committee if there are any questions from committee members. Mr. Bonta.
Welcome and congratulations, Director Smith. I just wanted to tell you that I'm looking forward to working with you. I'm honored to be the chair of the Assembly Health Committee in addition to being on this important subcommittee. We have a one-on-one meeting later this week. I'm very much looking forward to that. Working on a number of issues and challenges facing the Department of Public Health, including the licensing and certification program for our nursing homes, which I think we all agree needs real improvement. So I look forward to being a partner with you to make the changes that are necessary to help people in California. So welcome and look forward to working with you.
Thank you very much.
Mr. Chu.
First of all, again, thank you, Dr. Smith, for being here. And we had a chance to meet a couple weeks ago to talk about a number of issues. And one of the areas of concern that I raised with you were health disparities and impacts regarding our LGBTQ communities. And I'm wondering, since we've met, if you had had an opportunity to speak with your staff about various initiatives you're working on, if there are things that you might be able to say about that topic at this time.
I don't have specific details for you. However, I'm very excited to say that very soon we will be coming out, we hope, with the strategic plan for the Office of Health Equity, which Jamal can talk to you further about, and also that one of the populations that for which we have a specific report is the LGBTQ community. And so I think the combination of that and the strategic plan are going to really give us some good guideposts to go forward and make meaningful impacts.
Great. Look forward to those conversations.
Thank you, Dr. Smith. I appreciate your attention that you noted, the issues around prevention especially, and as you referenced obesity, I'm thinking about many of the districts that we represent have very high levels of obesity among young people. I can think of 2 school districts in my area where at least 50% of the kids are considered obese or have asthma or diabetes or other forms of illness, so we'll be interested in that. I would like to flag one thing for your consideration as you move forward, if there are resources that you can shed light on this issue, and that is the issue of sickle cell treatment. We've had a few presentations from sickle cell advocates, and they've raised concern that there are all kind of limitations on how a person gets treatment when their provider is outside of their county, and just concerns in general about the lack of funding for research and treatment that exists. And, we've had a chance to have a great meeting with Secretary Dooley, and what we've asked is for her help in how to leverage existing resources, whether they be federal or academic. But we'd like to also put that on your attention screen, too, for your consideration on any ways that your department can support those who are impacted by sickle cell.
Thank you. I'll definitely look into that.
Thank you. We know that Mr. Miller has prepared an update for us on the Office of Health, Equity, and Update. We welcome your presentation, sir.
Thank you.
Thank you.
Chairman Thurman, and to the subcommittee members, good to see you all again, and thankful for this opportunity to provide an update and to have a new leader and partner in our efforts to achieve health equity in the state of California. My three updates will address our California Reducing Disparities Project, which is specifically funded by Proposition 63, the Mental Health Services Act. My second update, which will be brief as well, is on the Health and All Policies Task Force and our team that we have in the Office of Health Equity that's working closely with that task force. And then third, the update on the California statewide plan to promote health and mental health equity. So first, our highlight is the progress that we're really delighted to share on our California Reducing Disparities Project. For that project, that is Prop 63 funded on prevention and early intervention, that targets 5 particular groups around prevention and early intervention, and it's African American, Latino, LGBTQ, Native American, and API. And the intent of this funding is to address stigma, discrimination, and the historical mental health inequity, particularly at the local levels that these communities that I've mentioned have existed. And of late, particularly on phase 1, we've made progress on coming to the concluding phases of the strategic plan that provides guidance on how our $60 million that's been allocated will be invested over the next 4 to 5 years. That strategic plan went to public comment, a 35-day public comment period that concluded February 17th, 2015. Our technical partner, which is the California Pan-Ethnic Health Network, or CPEN, they worked closely to consolidate the over 700 edits and or comments we received from local communities that provided feedback during that public comment on that strategic plan that provides guidance on what we call the CRDP project, the California Reducing Disparities Project. CPEN is working now to integrate those edits, to provide graphic design aspects of the document, and we're looking forward to submitting a final document, or they're looking forward to submitting a final document to us, and shortly thereafter we're looking to move forward with the review and approval process. Phase 2, which is really the most impactful component of how we invest that $60 million across communities in the state, is progressing as well. There's a one statewide evaluator contract, or let me back up. The purpose of CRDP is to evaluate and validate community-defined evidence and practices, and there are a variety of ways in which we're going to invest our dollars to coincide with that. One way is one statewide evaluator contract, which we're looking to award in August of 2015 to start awarding those contracts. 5 technical assistance provider contracts where we're looking to award starting in August of 2015. 15 capacity building pilot projects, which we're looking to award in September of 2015. And then 20 implementation demonstration pilot projects on the local level, where we're targeting September of 2015. For those solicitations, we put the draft solicitations out for public comment before we actually posted those to receive requests for proposals. And that's a unique niche of our Office of Health Equity. A value that we hold true is working closely with communities to provide feedback and engagement early on in the process so that we can demonstrate how we're doing business differently as a state entity and engaging communities early and taking on their feedback and their edits, particularly in the solicitation process. It's a great opportunity to demonstrate that. We've received a lot of feedback from our communities. That period of public comment to get feedback on the pre-draft solicitation started on March 5th, and it concluded on April 8th. So once we're currently working to integrate the feedback we received so that we can finalize those RFPs, and we're looking at targeting the month of May to get those bids out. And initially, our bids are going to include, in May, our one statewide evaluator contract as well as our technical assistance providers. We're delighted in that last year we had some delays in our efforts to move forward, but in a short period of time, we've made a lot of progress. Our communities that we work with across the state, our strategic planning work groups are looking forward to getting these solicitations out, and we're looking forward to the evaluation component. That is a critical piece of how we tie in after we invest the $60 million. Were these projects effective, and how we can take these culturally congruent practices and demonstrate their effectiveness. So we're pleased with the progress and look forward to pushing through the summer and into the fall to get the solicitations out and to ultimately award contracts and grants to communities in need. A quick update on our Portrait of Promise, which is the California statewide plan to promote health and mental health equity. This is per the mandate, the demographic analysis, as well as the strategic plan, our health equity strategic plan, which is the inaugural plan that we work closely with our advisory committee on, as well as our Health and All Policies Task Force. We've worked of late with the governor's office, our agency, as well as the Department of Finance to apply several edits and to ultimately get this to a place to where this plan can be published and disseminated across the state, and we can engage both private and public partners alike across the state to position us to achieve health equity. And we look forward to engaging with the legislative branch and various opportunities to brief on the specifics of that health equity statewide plan. And then lastly, we're honored to have the Health and All Policies team in the Office of Health Equity that allows us to work with the Health and All Policies Task Force. And there are 22 members of this task force. Within the last 12 months, this task force has been extremely busy working on everything from the Caltrans Active Transportation Program grants to general plan guidelines at the state and local county levels, as well as the governor's environmental goals and policy report. I'm excited about the future direction of the Health and All Policies Task Force, as it's going to be addressing a variety of topics, but one in particular is cross-cutting, and that in particular is community safety through violence prevention. And of each of those 22 task force members, violence prevention uniquely impacts each of those entities, whether it's the Department of Social Services, Department of Education, Transportation, and each of the task force members are really excited about that. And now I'll conclude there.
Thank you. Anything from Finance? Anything from the LEO's office here? Any questions from committee members? You talked a lot about various mental health efforts. Is there a benchmark by which we're measuring our success, that when we talk about mental health in the community, what is the benchmark that, aside from removing the stigma, which I really appreciate, yes, that's very, very critical, what is the benchmark by which we are measuring our success with these efforts?
It's an excellent question, and we actually have
I get all the great questions. I get to let you all have all the great answers. So.
Yeah, but we have a unique opportunity to really help create the benchmark. The strategic planning work groups, or the populations that we have been working with, are really responding to a long history of either being underserved, not served at all, and having fragmented relationships with local mental health departments. So a lot of the programs that we'll be investing in have never in the past received any public funding. They've not been recognized as being evidence-based. So many of the recommendations that the community provided through the population health specific reports, and if you don't have it, I'll make sure we share those with you, they've identified new opportunities that if we look at kind of the evidence-based standards that are the measure of success right now, it may not necessarily coincide with what's deemed successful with these communities that have been underserved or inappropriately served. So that's one of the unique benefits we have in investing the $60 million to demonstrate not only our ability to implement and get funding out, but to rigorously evaluate everything from community gardens to faith-based interventions that typically are not reimbursable and that have not been supported in some instances with public funding, for us to establish a new benchmark that integrates those and recognizes those as evidence-based, and thereby broadening the discussion as to what will make what will deem this effort successful, and hopefully long-term from a sustainability perspective. We would anticipate from a visionary perspective projects like these moving from demonstration projects to being fully integrated as to how local mental health departments are funded with Prop 63 funding that is more inclusive and expansive of the needs of the communities that I've shared.